take a second and talk about kind of unique challenges that patients with spina bifida might have in bowel management. It seems like compared to anorectal malformations patients or Hirschsprung's patients, sometimes just the anatomy and the low sphincter tone of the may make it more difficult for the balloon to kind of stay in place. And
yes, that's a good point. So, and it brings up a little bit more show and tell as well. So our traditional enema set is a 24 French Foley catheter that does have a balloon, as Dr. Garrison was mentioning. And what we do is, because a patient specifically with spina bifida and anorectal malformation, they often don't have the muscle tone to be able to hold in a large enema solution. So once we get the catheter in the rectum, we will blow up the balloon, which then creates a plug, so that when the enema solution is coming out the end, going into the bowel, you use this plug to help keep the solution in the body, because we know that the muscles and things like that are not able to hold it. So this balloon will help create that seal so the enema stays in the bowel. Now, sometimes with spina bifida, even the muscle tone is too loose to even hold this enema. So we do have other products that we can use. We have a different type of tube that has a larger balloon on it. I know there are families out there that are using cone enema sets, so I have seen patients that will use a cone enema set as well to do that. And then we also have another product that some families use, which, and this kind of gets also talking about independence, is the Peristeen product. And that also has two different size catheters. One is the length for pediatric, and one is the length for an adult. But this also has a much, much larger balloon that sometimes we'll use this Peristeen enema product to gain independence, as well as have some advantage of a larger balloon. But it definitely can be challenging on some patients with the muscle tone. But we do have a couple different options of trying some tricks of the trade to see if we can get the enema solution to be retained. Because the bottom line is, if the enema solution is not in the bowel, then we haven't really given an enema to help clean you out.